Thanks again, Virbac, for the opportunity to chat to you guys today about a topic that's really something that I deal with on a daily basis at my practice. I certainly see an ageing population of horses, and I think mine, as well as most vets' approaches to dealing with senior horses, have really evolved over the last 10 to 15 years. And precision care or precision medicine is really a term that's been coined from human medicine. This is where we've evolved now, where we no longer look at people or horses with a one-size-fits-all approach. And this is really important because, especially when we come to looking at senior animals, their needs are going to be very different based on the individual's genetics, their medical history, their current management, their overall health, and what it is their owners would like to get out of these older horses in their retirement years. So for example, you can see the little Shetland pony up the top there, that's Twiggy. He's basically just been a really cute paddock companion. Unfortunately for Twiggy though, is that he's constantly battled with being overweight. And that has led to other issues like chronic laminitis that his owners have been dealing with. And so his issues as he gets older are going to be quite different to the off-the-track thoroughbred that you can see there on the right. The owners here just want to keep her in really good health where they can go out, on the weekends to adult riding, maybe pop her over a few jumps. But she was a racehorse that raced till she was in her early teens. So she's got a few issues in terms of arthritis management that we have to deal with. These are quite different, again, to the Clydesdale, who's being used as a trail riding horse once a month by the older gentleman that has him. And he needs to stay healthy, in good body condition, to be able to carry his rider and to also keep him fit and healthy. The mare on the right, she's been used largely as a brood mare for the majority of her life. So again, I think you can hopefully see a bit of a picture developing here that each of these animals, their medical challenges that they face as they get older are going to be quite different. And we need to treat each of these animals as an individual and really tailor our approach to the individual horse in order to get the best outcomes we can for them as they get older. So I've decided to break this talk down into 4 key areas. And these are largely based on the questions that I get from my clients out in practice. So let's jump in and tackle each of these one at a time. So mobility is defined as the ability of an animal to move freely and easily. Now, there was a study done in older people which showed that those with mobility limitations actually had a lower health-related quality of life score than those with fewer limitations. So joint health is really important to comfort and activity. And I think we can say the same in horses, that reduced movement might affect their overall quality of life. So arthritis or degenerative joint disease is one of the leading causes of mobility issues in older horses. And this is a progressive condition that affects the cartilage within the horse's joints. Over time, the cartilage, which is the tissue that cushions and protects the bones during movement, begins to wear down, leading to inflammation, pain, and reduced mobility. As the disease progresses, the body may form bone spurs known as osteophytes, and the quality of the synovial fluid, which is the fluid which lubricates the joints, may deteriorate, which further impairs joint function. So there are a few common and sometimes less common signs of arthritis that we might see in horses. The first being stiffness, particularly after they've been resting or laying down for an extended period of time. And one of the things that owners might say to me is that their horse has gone down to, have a sleep overnight or lay down during the day. And when they've gone to stand back up, they've actually sat up like a dog for a few seconds or even a minute or so before they're able to get back on all 4 feet. And this generally tells me that there's probably some pain or weakness in their hindquarters and they might benefit from some pain management. If they're still in work, they might show reduced performance or willingness to move. Sometimes in severe cases, they might have swelling or heat around their joints, and they may even show lameness or an uneven gait when you walk or trot them. There's a few different ways we can manage arthritis. I guess the most common one that you guys might be aware of is from the use of non-steroidal anti-inflammatory medications. These are things like bute, firocoxib, or meloxicam. Now, short-term use of this is not usually a problem, but if they are being used in long-term or chronic cases, which some horses and ponies might need as they age, we really want to make sure that they don't have any gastrointestinal issues or any kidney issues going on before we prescribe these long-term. There are supplements you might also like to consider. I'm not going to delve into these. We could go on for an hour listing the whole plethora of supplements you might find in the feed store. But one that I do recommend to my clients and that I've used in my own animals is Epitalis. So this is the active ingredient in Foresight. And they've done a number of studies now on this particular supplement to show that it is very effective at addressing osteoarthritis in horses. Exercise, low-grade level of exercise might also be useful in keeping these guys a little bit more active. I find that if you're confining your senior horse to a yard or a stable overnight, they tend to take a lot longer to sort of get their joints working again throughout the day. So sometimes these guys might benefit just staying out for 24 hours with access to a walk-in, walk-out box rather than being confined to a small stable or yard. You want to make sure you maintain regular farriery. These guys, even though they may not be in work, they still need to maintain regular hoof care. Acupuncture is something that I've seen to be quite effective in some horses, less so in others. It's really on an individual basis, but it could be something to consider if you're thinking that you have an older horse with arthritis that you'd like to manage in a slightly different way. Right, we're going to shift gears now and look at maintaining weight. So I think before we go on to addressing the different weight issues, I think we need to know how to assess body condition. And what I train my clients to do is to look at it in a 1 to 9 body condition scoring scale. And this is a validated scale that was published, gosh, about 20, 30 years ago now, called the Henneke scale. It's a standardized 9-point system. It looks for fat deposits in key areas. And the ideal range where you want to keep your senior horses on this scale is somewhere between 4 to 6. A condition score of 1 to 3 would probably be too thin, and almost certainly a body condition score anywhere from 7 to 9 would be obese. So the two most common things that owners might face are either weight loss or obesity in their older horses. So starting first for weight loss, there's a few different reasons why weight loss could happen. The first one being inadequate nutrition. That's probably the most common. Dental issues, things like EOTRH, things like worn teeth, they can all contribute significantly. Parasites could also play a role, whether you have resistant parasites or your parasite control strategy is not appropriate for your senior horse. Chronic diseases like PPID that haven't been addressed can also be a cause of muscle atrophy and weight loss. Gastric ulcers, like you can see the top right there, this horse has glandular gastric disease. It's got large nodular lesions present near their pylorus. And that's this particular case here is quite an aggressive form of nodular lesions, and this can potentially obstruct gastric outflow. And you may see other signs if your horse has this, like recurrent colic. Chronic pain and stress can also lead to weight loss. And something we always keep on our list of differentials as veterinarians is neoplasia. And that's just a technical term for cancer. As horses age, they become I guess cancer is something that we always need to consider in older animals. And if we look at the bottom right picture here, that's the appearance of the inside of a horse's stomach on gastroscopy for a weight loss investigation. And this horse's squamous mucosa, which should normally be white and glistening and smooth, have this really raised areas. There was also a putrid odor coming from this horse's mouth. And this horse actually had gastric squamous cell carcinoma. So signs that owners can hopefully easily recognize are obviously if the ribs become too visible, if the hip bones are very prominent, if they get loss of muscle along their top line, they may have a dull coat, they may not be eating quite as much, they may be slow to eat, they may be quitting and dropping feed. And they may have behavioural changes, so they may be quite irritable, they may be quite lethargic. These are all indications that you should really get your veterinarian involved just to take a little bit of a deeper look into why your horse might be losing weight. So the first thing we try to address is nutrition. Some horses, like this guy here, he hasn't got much teeth left, so his owners feed him a nice sloppy mash. And this allows him to get enough calories as he needs because he's unable to chew long stem fiber like hay. So there are a lot of senior horse formulated feeds out there which are really good and are designed to meet the caloric requirements of an older horse as they age. You might also want to consider high fat feeds. You can also soak their hay or use hay replacer cubes if they're unable to chew longer stem hay. But providing a good amount of roughage is really important for things like preventing gastric ulcers and also promoting good hindgut health. Now, another thing that owners may not realise is that as the horses get older, their position in the herd might move down. So they may be getting bullied off their feed. Even though you might be feeding them exactly what they need, if they're not actually able to eat it and the little fat pony is bullying them off their food, well, that's not going to help them put much weight on. Dental care is also something that's very important. We usually recommend older horses get looked at, every 6 months or so because of changes that can be occurring in their mouth. We've got some really good specialist veterinary dentists all around Australia that you can get in touch with that have got great scopes and different equipment that can address any dental issues on site. Parasite management, we're going to come to talk about this in a little bit more detail, but performing regular fecal egg counts and having a strategic deworming program in place for your senior horse is really important because parasites can be a cause of weight loss, especially in older horses, and it's a really simple thing to address and manage. So chronic diseases, again, we're going to come to talk about PPID in a little bit more detail, but, there's also things that we may not think about immediately, but these are things like declining liver or kidney function. And getting a vet out to perform a simple blood test can help check the overall health of your horse. And even though they may not find anything on the blood test, just gives you a baseline by which to work off if your horse does develop issues down the track. Gastric disease. It wouldn't be a Virbac webinar if I didn't mention gastric disease. Now, there's a lot of owners that would like to just go, hey, look, just give me a box of Gastrazole. I think my horse has ulcers. Let's treat it and see how we go. The important thing to realize is that, horses can have two different types of gastric disease. And the only way to know which one it has is to perform a gastroscopy. And the treatment programs are going to differ significantly depending if your horse has squamous gastric disease or glandular gastric disease or both. So without knowing which of these your horse has, you're really working blindly, and it might end up costing you a lot more money because you might choose the inappropriate treatment to begin with. So it's a really simple, easy procedure that can be done in the field to perform a gastroscopy, just in case we're worried that gastric ulcers might be a cause of weight loss in your horse. Right, now if we look at the other end of the spectrum in terms of obesity, I think, well, hopefully everybody can recognize that this mare here is well and truly obese. She would be a body condition score of 9. She has clear fat deposits around her crest, around her shoulders and her tail head. You definitely can't feel her ribs. And she just generally has this big apple-shaped body. So, this is not an ideal body condition. Most people get quite shocked if they see a horse in lean body condition, but I get very worried when I see a horse in this obese body condition because there's a whole slew of metabolic issues that come along with it, and it can severely compromise your horse's welfare. So how you want to manage these horses is quite different to obviously a lean horse. You want to provide low sugar forage or hay, which ideally is less than 10% non-structural carbohydrates. There are some variable results to soaking hay to remove excessive sugars. I will say that if you are doing this, especially in warmer climates, make sure that you don't leave hay soaking for more than 6 to 8 hours because this can increase the microbial growth on the hay. You also want to make sure that you don't allow the hay to just hang out and drip dry in the stable before you feed it to the horse. You want to take it immediately out of the soaking tub and feed it to them. You want to feed them at 1 to 1.5% of their body weight. And this is important to be able to facilitate weight loss. Exercise, as long as they don't have laminitis or any other lameness issues, your veterinarian can help you tailor an exercise-based program for your horse. Even though light groundwork can be really useful to begin with, but it's important to note that just walking your horse around the fire break or taking your little pony up to the letterbox to get your mail is not going to get them to lose weight. So as long as they don't have laminitis and they can be exercised, you want them in a program, or at least work up to a program where they're huffing, puffing and sweating at least 3 to 5 times per week. Feeding practices, you can use slow feeder hay nets to prolong the eating time and reduce boredom. And this can also extend the feeding window. So, we are restricting the amount of hay or feed these guys get. So being able to mimic normal horse behavior throughout the day by slowing them down a little bit, I think is always a good idea. And then performing metabolic testing. If your horse is obese, they are going to be at a significantly higher risk for developing laminitis because those fat deposits are contributing to what's called insulin dysregulation. Your obese horse may also have PPID, and we're going to come along to talk about how we diagnose and manage that shortly. Right, shifting gears now to parasite management. Now, parasite management program is really important for senior horses. This is because they typically have reduced immunity and might be more vulnerable to parasites. Many of these horses in their 20s and 30s have been over dewormed in their younger years before people were aware of the harmful effects of overusing dewormers. And we want to make sure that we only treat them when they're necessary. So fecal egg counts are probably the cornerstone of your parasite management program. But having said that, though, don't forget all the usual boring things like getting out there and poo picking your paddocks twice weekly. This can significantly reduce your parasite load and will also reduce your reliance on dewormers. So how do we use fecal egg counts effectively in senior horses? Well, basically, you ideally want to test 2 to 4 times a year. I prefer 4 times a year because that gives you an idea of your horse's parasite shedding status at each season. But if you can only manage twice a year, then aim for spring and autumn. Now, be well aware, and this is a common misconception, but the fecal egg count of your horse does not correlate to the worm burden of your horse. So just because your horse might have a high fecal egg count does not mean that they have a high parasite burden, and vice versa. All it tells us is the amount of parasite eggs that your horse is shedding onto your pasture. There is no correlation with worm burden and fecal egg counts. But depending on what you find on your fecal egg counts, you want to treat these high shedding horses. So if your horse consistently sheds over 500 eggs per gram on a fecal egg count, you might want to target deworming of 2 to 3 times per year compared to most other horses, which are going to be low shedders and typically only need deworming once a year. Another really important thing for which fecal egg counts are used for, this is probably, in my mind anyway, I think this is probably the most important use of a fecal egg count, is it allows us to test how effective the deworming treatment you just used was. Like I said, parasite resistance is really common in horses due to the overuse of dewormers. And resistance simply means that the worms in your horse are resistant to the deworming compound you're using. So these parasites continue to survive despite you administering a dewormer. And that's because parasites over 10 to 20 years have evolved and we don't actually have any new deworming products on the market. So we've been using the same deworming compounds for the last 20 to 40 years in horses. And parasites are unfortunately much smarter than us. and have evolved ways to survive despite these deworming treatments. So we want to test to make sure that the deworming treatments you're using are effective in your horse. And by doing that, it's really simple. You collect a fecal sample before administering the dewormer. You get that sent off for a fecal egg count. You administer the recommended dose of the dewormer that your veterinarian has told you to, and then you collect another fecal sample 14 days later. There are some people that recommend 10 days, but the majority of the published research recommends collecting a fecal sample exactly 14 days later. And what you want to make sure is that the amount of parasite eggs that your horse is shedding has reduced by at least 90%. If you have anything less than 90% reduction, it means that your horse has resistance to that deworming product. There has also been research to show that once you have resistance develops, it doesn't go away. You cannot deworm your horse for another 10 years and you won't change the resistance patterns. So again, really important to use fecal egg counts to target deworming to horses that are shedding the highest amount of parasite eggs onto your pasture, and also to test the efficacy of your dewormers. So we're going to talk about PPID now, also known as pituitary pars intermedia dysfunction, also known as Cushing's disease by many horse owners. It is one of the most common endocrine or hormonal disorders of aging horses, and there have been studies that estimate approximately 1/3 of horses over 15 years of age actually have PPID. Some common signs include hypertrichosis, which is this long curly coat that fails to shed in spring and summer. They may have recurrent episodes of laminitis. They may be quite lethargic. They may have muscle wastage, especially over their top line and their rump. And they might also be prone to recurrent infections, like recurrent foot abscesses, sinus infections. They may have corneal ulcers that take a lot longer to heal. They may have small wounds that seem to delayed healing as well. And those are all common signs of PPID. Now, one thing I do want to point out is that just because your horse doesn't have this long curly coat doesn't rule out PPID. Not all horses with PPID will have this little curly shaggy coat that doesn't come out over summer. Some will have completely normal coats, but will also have a number of these other signs. So don't ignore it just because your horse has a normal coat. Now, what happens with PPID is that there's a degeneration of certain neurons within the pituitary gland, and this is just the small little gland that sits at the base of the brain. It's the master hormone gland in the body, and it's responsible for a number of different hormones being produced and regulated. So PPID, what happens here is it causes an overproduction of certain hormones. And the way we diagnose PPID is via blood tests where we actually measure one of these hormones called adrenocorticotropic hormone, or ACTH. This is a very simple one-off blood test, but there are seasonal variations, and in the early stages of disease, we might miss it on this simple test. The test that I like to perform and is now available to be performed in Australia is called the TRH stimulation test. And this is a much more sensitive test which allows us to identify horses with PPID, which might be missed just on a one-off ACTH sample. So if your horse has had a quote-unquote negative ACTH response on previous tests, but falls into this category where, they're showing some other signs, certainly discuss with your vet about performing a TRH stimulation test. It's really simple and easy to perform. It takes 10 minutes to do, and we can do this out on your property. It's important that the results of an ACTH test are interpreted according to their seasonal variation. So in autumn, we see a peak in ACTH levels, and this is just a normal rise that occurs in horses. So some of us will not want to do our routine screening for PPID during the autumn months. We also tend not to perform the TRH stimulation test in autumn. I tend to do that more over the winter, spring, and early summer. You certainly can still do any of the tests. You just have to, or your veterinarian will have to interpret the results quite carefully, because we don't want to overdiagnose this condition and then commit an owner to treatment when it just was a excessive level because it was tested in the autumn. So treatment of PPID involves the administration of medications called dopamine agonists. I think the ones we probably all know about is called Pergolide. It's a once daily tablet. There is also a compounded Pergolide paste that is available in some areas. And we now also have an extended release injectable cabergoline injection, which is a once weekly injection. It's unregistered for use in horses, but you might want to consider it if you're unable to medicate your horse daily, or like many little ponies, just run away if they know someone's catching them to give them their pill. So it just provides an alternative treatment that you can discuss with your vet whether or not it's suitable. Treatment with either of these medications, though, is lifelong. Now, another thing I wanted to talk about is with senior horses, it's really important that we always keep in the back of our mind as to what is their quality of life. And we have a small checklist to determine whether or not they have a good quality of life. Because obviously, as they get older, we might get closer to having to make that decision as to whether or not their quality of life is declining. So look for behavioural changes. Is your horse interacting with its herd mates? Is it interacting with you? Are there any sudden behavioural changes? Is a horse that was usually quite friendly has suddenly become quite aggressive or anxious? What's their appetite like? I mean, this is a big one for me. For horses, older horses that stop eating will lose weight very, very quickly. And that can typically indicate that they're, if you've addressed all the more common issues like dental disease and nutrition and gastric ulcers and things like that, it could potentially mean that they have some sort of neoplastic process or cancer. And if you have a horse that, has suddenly stopped eating and is dramatically losing weight, I'd consider getting your vet out for an examination. Are they able to maintain their weight? Does their coat look healthy? How mobile are they? Some horses, as they age, they still like to be in amongst it. They still like to go out for their, weekend trail rides, whereas others just like to hang out in their paddock with their mates and be left alone. They're very much like people. They're all individuals, and it's important that we treat them that way and, respect what they want to do as they age. I think they've earned it. Are they passing manure normally too? Have their manure change in consistency, in frequency? Horses with chronic diarrhea also require a veterinary examination. This can also indicate a more sinister underlying problem. And again, pain and discomfort, which is what we touched on when we talked about mobility. Are they able to move around freely? Are they able to get up and down without discomfort? Have you noticed that you've never seen your horse go down to roll or you don't see them lay down? This can all be signs that they realize it's going to be really difficult for them to get back up again. So they don't go down to roll and they don't want to lay down to sleep too. So these are all little telltale signs. And one thing that's really, really important to understand is that horses are prey animals. It's not in their nature to show outward signs of pain because if they did in a wild, they might be targeted by an animal who might come along and eat them. So they aren't going to, show outward signs of pain or discomfort. They certainly don't vocalize when they're painful. And it's really up to us to notice those really subtle signs and to do what we can to keep them as comfortable as possible as they age. So just a few points to touch on before we finish up. It's really important that you pay attention to your horse and you know what's normal so you can quickly spot when something isn't right. Have a good relationship with your regular veterinarian and schedule regular veterinary appointments. That helps allow for early diagnosis and treatment of conditions before they escalate. This is particularly important when it comes to older horses where our margin for error might be a little bit less than if your horse was younger. It's really important to tailor their management to their individual needs. Your 23-year-old fat little round Shetland might have very different needs to your 18-year-old thoroughbred who you struggle to keep weight on. And again, lastly, but definitely not least, is pay regular attention to their quality of life. go through that checklist that we talked about, look for very subtle changes over time. It's really hard when you're looking at them every day, but if you have those specific points to think about, you might notice that there's something that it really isn't right. And you can address those issues before it gets too late. So thanks everybody for tuning in, and yeah, I'm happy to take any questions.
Excellent. Thank you so much, Tania, for your presentation. We're into the final part of the evening. I'm just sharing my camera back. So we've got plenty of questions, so hopefully we can
Okay.
get through all tonight. So if you do have any questions, please send them through the chat, and we'll be able to answer them as best as we can. Otherwise, if they don't get answered tonight, don't worry, we will answer every question after the webinar. So I'll just head straight into it. The first question is, I'm sorry if I butcher these words, should pentazan or arthropin be used? And if so, in conjunction with Epitalus?
Yeah, that's a good question. I certainly had my older client on both of those medications, and I found it really helped. I guess their response to Pentosan can sometimes be quite individual, and the frequency that you'd want to administer it to. Every vet seems to have different protocols as to how frequently you administer it and how often. So I would chat to your vet about it. It's certainly something that can help horses, and especially if you have some with over arthritis through several joints, and Pentosan polysulfate can certainly help.
Thank you, Tania. Next question. Do you find that horses that receive a joint supplement on a daily basis seem to have better joint health and performance over time?
It's a good question. I think there's joint supplements and then there's joint supplements, right? So it really depends what their baseline level of lameness was to begin with. I think those with quite severe osteoarthritic changes may not see as much benefit from a once daily oral supplementation. I'm sure it's not going to hurt the horse, but some of those might need some targeted intra-articular. So that's where your veterinarian might want to inject something like arthramid or even some corticosteroids into joints that for some very specific treatment. But overall, I certainly don't think they're going to hurt the horse, and they should be doing hopefully something to help. But it really depends on the joint supplement that you're using. And I guess if you found one that's helped your horse, then by all means stick to it. But if you don't find that it's helping, then it might be worthwhile chatting to your vet about what supplements might be more suitable for your animal.
Thank you, Tania. Next question is, what do you recommend when starting treatment with PPID medication and horses become quote unquote depressed?
It's a good question. I've had that conversation 3 times in the last 24 hours with owners. So it can happen. About 1/3 of horses or so will show some side effects when they start treatment with either pergolide or cabergoline. It's a known side effect of the medication. So if you do notice that your horse is becoming a little bit dull or depressed, what I would typically do if those signs don't subside over the first 24 to 48 hours, I will typically tell owners to stop the medication and wait until their horse is back to normal and eating and drinking well, and then restart the treatment in a couple of days, but on a much lower dose. Unfortunately, there's been no studies around that have been able to predict which horse is going to show those signs of becoming inappetent or look really dull or depressed. There are some horses which show those signs on the oral pergolide, but don't show those signs when we try intramuscular cabergoline, and vice versa. So it's, again, horses for courses. It's a matter of finding out what individual treatment suits your horse the best.
Thanks, Tania. The next question is, if a horse needs to be sedated for dentistry, is it a higher risk? Is the sedative dangerous?
I think used appropriately by your veterinary dentist, who's obviously going to perform a full physical examination prior to administering the sedation. I don't think there's any added risk. this is a little bit outside my wheelhouse because I don't do much dentistry these days. And I know there's at least one dentist listening, so it'd be nice if he decided to chime in on the chat. But one of the things that I think is important, why sedation is so important, is that it allows for a really thorough oral examination. And this is particularly important in older horses if they have some significant dental issues or dental disease where they might need a little bit more work to get done. Then I think the sedation allows us to do that in a safe environment. It provides some pain relief for the horse too. And I think that's really important. I think you need to prioritise getting a thorough oral examination and allowing your veterinary dentist to do what they need to do, rather than, struggling and fighting with an unsedated horse, which might end up causing them more trauma in the long run.
Excellent. Thanks, Tania. The questions are flowing thick and fast, so we'll try to get through as much as possible. Please type your questions in. All questions will be answered, if not tonight, after the webinar. Next question is, if ulcers are found in our older horses after scoping, what is the best treatment? Should we be using a gut supplement or something else?
Sorry, I just dropped out on the start of that question. Could you just repeat that again?
Yeah. If ulcers are found in our older horses after scoping, what is the best treatment? Gut supplements or something else?
I would certainly recommend a proton pump inhibitor. So there's good evidence now that drugs like omeprazole reduce gastric acid to allow those gastric ulcers to heal. Obviously, I think they only should be used for the duration that's necessary to treat those ulcers. I don't necessarily think those medications should be used long term in the vast majority of animals where their management should take priority, and we should feed them and manage them appropriately, especially in an older horse, which is unlikely to be in a high risk environment like a racehorse or a racing stable. So I think an omeprazole type medication initially to allow those ulcers to heal. Hopefully on a rescope, you have good evidence that shows that you've got endoscopic healing. And then after that is really about addressing the management and dietary factors that may have contributed to the developing of ulcers in the first place, and try to address those to stop them from recurring again.
Thanks, Tania. This one's a bit of a longer question, so I'll just try to paraphrase. My horse has degenerative bone disorder and has started to develop severe separation anxiety about 2 years ago at age 23. And it's becoming quite an issue with the safety of humans. They've tried local vets with no avail. They're currently using ACE, and that did not work. He's coat shiny, and he's lost some weight. Any help from that?
I guess I need a little bit more information. Is it the degenerative joint disease that's the issue, or is it the separation anxiety that's the problem? So, or are you dealing with both of those things? And both of those things obviously are going to be addressed separately. There is some potential use for some anti-anxiety medications in horses too. I can't say I've kept up with much of the literature on that, but that's certainly a conversation to have with your veterinarian. As far as the degenerative joint disease goes, I think, we've discussed supplements like Pentosan and Epitalus could really help. Depending on the severity of the condition, if it's localized to one joint or other joints, you might want to also speak to your veterinarian about some targeted intra-articular medication to help with that.
Thanks, Tania. The next question is, why do some horses put on weight with PPID and some horses lose weight?
So that's a good question. So if they have PPID that's not controlled, it does put them in what's called a catabolic state. So it does lead to a lot of muscle wastage if the condition isn't addressed and treated. But not all horses will lose condition. There are some EMS or equine metabolic syndrome, which we didn't really have any time to touch on today, but they tend to be those horses that carry the extra weight, especially around their crest of their neck, their tail head, or around their shoulders. So those horses are probably more genetically predisposed to get a little bit heavier over time. And certainly if you treat their PPID and you prevent the skinnier horses from losing more muscle, and their ACTH levels are well controlled, they can certainly put weight back on. And if they're not putting weight back on, and you've addressed all those, common underlying things like worming, dentistry, pergolide, gastric ulcers, nutrition, if you've addressed all those things and your horse is still continuing to lose weight, then I'd suggest getting more in-depth workup done, which might include some blood work. It might include also an abdominal ultrasound.
Thanks, Tania. We've got about 5 more minutes worth of questions, so I'll continue. Speaking of pergolide, what's the lowest dose you have used on smaller breeds, given the struggle with not crushing the medication?
Yeah, that's a good question. It's certainly an area there's a big gap in the therapeutic market in Australia, in order to be able to treat those smaller horses. It's tricky. I've certainly had owners quarter pergolide tablet or percent tablets before. I'm not sure how effective that is because I don't think anybody can guarantee how evenly distributed the drug is into that one tablet. So I do exercise some caution with that, but we don't really have that much in the way of other options in terms of being able to titrate the dose down for the smaller guys. But it's the lowest effective dose basically. If your horse is well managed on a quarter tablet, then and blood work has shown that this is the case and their clinical signs have improved when they're on treatment, then I think that's fine. But yes, you've definitely highlighted a big gap in being able to treat some smaller horses. It's a problem I have on at least a weekly basis.
Thank you, Tania. Next question is about melanoma in aging grey horses. Will the melanomas affect the horse's performance or quality of life? Areas affected, specific to this example, is under the tail and small nodules on the spine, which is non-reactive to pressure. And I guess they're asking for recommendations to keep the melanomas from spreading.
It's a good question. Whether or not it affects their quality of life in those areas, probably not, unless they get really, really big. I mean, I've seen some of them where, if you lift the tail up, it almost looks like there's a bunch of grapes under there. And those can get to a point where they become really ulcerated. And we have to remember that if they are, it's in an area that's having manure pass through it on a regular basis. So they're really, really hard to keep clean and keep on top of. Over the spine, potentially, if you're riding the horse. But I think one thing to take note of is that if all the external melanomas that we see, there's also quite likely internal melanomas that we don't see. And if you have a grey horse that's losing weight quite rapidly, if they're having recurrent colic and those sorts of things, then they really do need a more in-depth investigation, whether it be through a rectal exam or with a ultrasound exam. That can definitely provide a little bit more information. Protection from the sun, all those sorts of things to prevent any sunburn or damage to those ulcerated areas can also really help. There is a melanoma vaccine that's available. I don't know, I certainly haven't used it. I know there are some practices that are, but that probably is more of a specialist hospital question. And I'm sure your local referral centres will be able to provide you with a bit more information about that.
Thanks for that, Tania. There's actually quite a few melanoma questions, but I'll get through them probably at a later date. One of my older horses has high fecal egg counts, the other 0. Should I still worm the 0 once a year or leave him?
Definitely still worm them once a year. Fecal egg counts don't count things like tapeworms or encysted larvae that burrow into the wall of the large colon. So I think all horses should be treated once a year, regardless of their fecal egg count status. Especially the low shedders. And I'd be using either moxidectin or ivermectin based product for that. And your high shedder, that horse should be probably getting dewormed 2 to 3 times a year. And then obviously don't forget all the boring pasture management stuff like picking up manure, composting it away from grazing areas and things like that.
Thanks, Tania. Next question is, with feed regarding EMS Pony Active and at Pony Club and trying to keep a balance of energy. Sorry, I'm just trying to understand this question. How do you keep the energy feed and weight control balance.
So
That
if
wasn't
you've got an EMS, is that really if you've got an EMS horse, but you're trying
Yeah,
to feed them as low sugar as possible, but you still want them to be able to compete and exercise? Yeah,
yeah.
that's a good question. I think that I'm assuming the EMS horse might be an overweight type that you're wanting to restrict calories with too. Um, or I guess you could be asking about a leaner horse too. But I guess my answer is somewhat the same. You can provide extra calories that they might need in the form of fats and oils. I think most mammalian species will try to preferentially use glucose or sugar as an energy source, but when that's not available, they can utilize fatty acids. So you can certainly provide fats and oils. Unmolassed beet pulp too can provide a good amount of calories to these horses, especially those lean types that need some extra calories in a safe way without sending their insulin levels through the roof. So those are probably my two things of fats and oils and roughage like beet pulp. Sorry, you muted, David.
Thanks for that. The next question is, what was the... Oh, okay. What was the new treatment for laminitis that you won an award for in 2023? So,
So that's a drug called atagliflozin. It belongs to a class of drugs called SGLT2 inhibitors, and they're human medicines that have been around for at least over a decade now in people that have been used to treat type 2 diabetes. And the way that the drug works is that it prevents the kidneys from reabsorbing glucose back into the bloodstream. Humans and horses, as we know now, pee out all their glucose through their urine, and that reduces the stimulus for insulin to be released from the pancreas. So that brings their insulin levels down and does that quite rapidly. So, and in doing so, it definitely helps promote recovery from laminitis and also helps prevent laminitis from developing.
all right, thank you so much. So we've probably got time for another 4 questions. So the next question is, how can I help reduce back muscle wastage in senior horses still under saddle?
Yep, so that's a good question. I think you want to make sure if you're ever trying to build top line, I guess this goes for any horse of any age, is you want to make sure that you're providing adequate amounts of protein in the diet. Protein and amino acids are obviously the building blocks of muscle. So not all protein, though, is created equal. There's different quality types of protein, and you want to make sure that the diet consists of a good amount of lysine. Lysine is the rate limiting amino acid. So basically what that means is that if there isn't enough lysine in the diet, the body can't go through all the other steps to form the building blocks of good muscle. Lysine's found in feeds like lupins, soybean meal, all those sorts of things. I'd suggest, maybe looking at the diet first to get an idea of how much protein's in there, is there enough, and is the quality appropriate? And the other thing too would be to, you really want to sort of build some core strength so those horses feel comfortable rounding through their back musculature, doing exercises over poles, doing some physio work, working with some bands called equibands can also really help too. But yeah, the first thing I would look at is just to make sure that you are giving your horse an appropriate amount of dietary protein.
Tanya. Third last question. Coming back to pergolide, paste or tablets? Have you seen different results?
The only paste that I've had any experience with is the compounded pergolide paste from Veterinary Compounding Pharmacy in Australia, and I've used both of them, and I've had good results with both the paste and the tablets. Obviously, the tablets are a registered medication, and we've got quite a lot of experience with using that in Australia. And yeah, I don't see. I haven't had really any issues with the pergolide tablets. I think it's a very good product, and yeah, it's much of a muchness. I guess it's how you can get the horse to take their once daily medication really depends on the formulation you might want to be looking at.
Thank you so much. Second last question for the evening. If you're told your pony of 18 to 20 has critical hormonal levels, what does this mean?
I need more information again. What do they mean by hormonal levels? There's
Mm,
lots of hormones, so if that participant might want to just add a bit more detail in there, we'll try to get to it after the webinar.
perfect, no worries. So, final question of the evening, best supplement slash feed for energy plus protein whilst managing weight.
Um, Best feed for energy plus protein. I um I will take a bit of a cop out answer for this, but I will tend to recommend sort of complete balanced feeds. So I like the senior horse feeds. We know that I think you might run into some issues if you wanting to feed whole grains. There's absolutely nothing wrong with feeding that, but you have to realize that the quality and the nutritional profile of grains are going to vary from batch to batch and from year to year and season to season. So I like feeding the complete feeds. So whether it's a complete senior horse feed, or a high calorie feed if your horse needs to gain weight, or a low starch feed if they need to lose weight and they've got EMS as well and you're trying to prevent laminitis. I think that takes a lot of the guesswork, for many owners out. It does come at a bit more of a cost, but I think that's a much easier way of providing all your vitamins, all your minerals, and your protein requirements in that one feed.
Excellent. Thank you so much, Tanya. There was a lot of questions, and we've still got plenty more, but we might have to wrap it up. So I'm just going to share my screen to wrap up. So thank you again for all the questions. There was definitely quite a lot. So if you do have any still remaining, please send them through. And if you think of other questions, please send them through to Virbac, and we'll be more than happy to connect you with the right person. Remember, this webinar has been recorded and will be made available via an email, which everyone will receive shortly. Now, before we finish, I'm actually very excited to announce the winners of the bonus prizes tonight. So the winner of the Lucky Draw prize is Julianne McDonald. Congratulations. And the winner of the participation prize, sponsored by Horseland, is Isabel Pozza. So congratulations. We'll reach out after the webinar tonight to organize your prizes. Before we end, I'd just like to quickly let everyone know that as proud sponsors of Riding for the Disabled Association Australia, Virbac and Horseland are running a special campaign this month from the 20th of March to 20th of April, where $2 from every purchase of a Virbac product from Horseland stores will be donated to the association. So please join us in supporting this wonderful organization, and head into your Horseland store this month. So again, this session was recorded and will be sent out via an email in the coming days. If you